I'm Kristen, and I'm here today with Dr. Brown, and we're going to talk about essential oils. I know that essential oils have gained a lot of popularity the last few years, especially with moms. I know moms are using them in their home, diffusing them, and really excited about them. So I just wanted to give Dr. Brown an opportunity to kind of explain maybe what exactly is an essential oil and why you would want to use maybe an essential oil versus a homeopathic, and just kind of let him give his medical opinion on them. So Dr. Brown, we're going to start with the basics. What exactly is an essential oil?
Well, basically, an essential oil is a highly concentrated form of herbal medicine. And so you start with the plant, you extract the oil, and distill it down into a very concentrated form.
Okay. Do you ever use essential oils in your practice?
Very rarely. I prefer to use homeopathic remedies.
Oh, okay. So can you kind of tell us maybe the difference between a homeopathic remedy and an essential oil?
Well, like I said, an essential oil is an herbal medicine. And so medicines are used to treat symptoms. And that's how essential oils work. They primarily treat symptoms. Now, there are some oils that have antiviral, antifungal properties, that type of thing. But most of the time when you're using an oil, you're simply treating the symptoms. And once the oil wears off, then you have to, use it again. And whereas homeopathy stimulates the body to its own immune system to heal internally. So you may have to give a few doses of the remedy, but you actually fully heal and you're done with it.
Yeah, so we're fixing the problem versus
treating the symptom.
Okay, awesome. So are there any other reasons that you prefer homeopathy over an essential oil in your practice?
There's a couple of reasons. One is that with homeopathy you can isolate the treatment to the individual who's getting the remedy.
Gotcha.
Whereas when you use essential oils, everyone who comes into contact with that person is essentially breathing the oil and being affected by it. Sometimes that could be a good thing, but sometimes that can be a bad thing. For instance, one person may use peppermint to treat their headache, but in another person, if they breathe it, it can actually cause a headache.
Oh, wow.
And so you don't want to do that. I actually treated a massage therapist who was using a lot of essential oils, and she developed severe hormone imbalances because she was using oils that were wrong for her. And so you do have to be careful with essential oils.
Okay. So we know that they work differently, so that's one reason that you use homeopathy in your practice. Another reason you said is that you can isolate who gets the treatment. Is there anything else?
Yeah, basically homeopathy is more powerful than essential oils. So like I said, it's not a bad thing to treat symptoms. Sometimes you need to do that. However, homeopathy just works on a much deeper level and is much more powerful. For instance, I've never seen an essential oil keep someone, from needing medical care. Whereas homeopathy, if it's used correctly, can. Let me give you an example. Several years ago, my oldest son sliced his scalp open. And for all of you who know anything about scalp wounds, the scalp is highly vascular and it bleeds profusely. And so, luckily, my wife had a homeopathic remedy on her called arnica, and she was able to give it right away, and it instantly stopped the bleeding. I don't know of an essential oil that can have that dramatic, instant type of effect.
Right. So, would there be a reason that you would want to use an essential oil? Like, is there an example for that?
Well, again, I tend to use homeopathy first.
Right.
I use essential oils as a backup. If there are times, homeopathy, again, it relies on the body's immune system being able to respond. There are times when the immune system can be so depleted that it's not able to make a response.
Right.
And so that's when I would consider using an essential oil as a backup, but I don't use it as a primary.
Okay. Well, that kind of leads me to another question. I mean, you're a doctor and you know a ton about homeopathics. So is that kind of, a reason why maybe some people at home prefer the, essential oils?
Well, the essential oils are easier to learn because it essentially is, this for that type of thing. Whereas homeopathy is much more complex in that most of the time, it's not this for that. It's, okay, here's the situation, here's the exact way it's affecting this person. Now, based on that information, I can get the exact correct remedy.
Right.
And so there is a much steeper learning curve to homeopathy than essential oils. However, the effects of the homeopathic remedy are much greater.
Yeah, so what I'm hearing is basically, homeopathy is very specific. And
Very
so
specific.
I think that that's probably why a lot of moms are intimidated by, learning about homeopathy versus maybe using the essential oils because they are easier to use.
Right, but the good thing is, while, learning to prescribe homeopathics to treat, more serious and chronic diseases is very, very difficult and should be left to the professional.
Right.
However, anyone can learn how to use homeopathy to treat, first aid and, acute limiting conditions.
Right.
Without, with a little bit of study, but
Yeah.
it can be easily learned and implemented at home, and it can prevent a lot of serious situations, and it can even, prevent a trip to the ER.
Wow.
For instance, let's take, right now there's a bad stomach virus going around.
Mm-hmm.
So you could use essential oils to, try to help ease the symptoms of it, and they would do that. Or you could give the right homeopathic and stop the whole process.
Right.
Whereas if maybe you didn't give the right homeopathic, you end up with a child who's severely dehydrated because of the, the diarrhea and the vomiting, and they can't keep anything down, and then you're at the ER, getting a shot of Zofran and an IV.
Right.
Whereas if you, given the right homeopathic early on, you would have stopped the disease and prevented that whole scenario.
Well, I'm kind of a case in point. I mean, I'm a mom. I don't have a medical background. And over the last several years, especially because I've gotten to work so closely with Dr. Brown, I do think homeopathy first. That's just kind of how I think. And so I do know that one of the main symptoms for nausea and vomiting is arsenic amalgam, and that's going to be one of the commonly indicated, remedy to give. And so it can be done. You can learn homeopathy and how to use it for your family. And so that is kind of why I'm so passionate about what we do here at marpeywellness.com, because I know that there's things that you can do at home to help your family that work almost miraculously. I've seen it in my own house. I've seen it with my own kids. And so that is what one of our main missions is, to really simplify homeopathy. And that really, we did that with our cold and flu kit. So,
We did.
So here's my question. I know a lot of moms, they want to use the essential oils that they've enjoyed using over the last year or whatever, it's worked for them. Can they use an essential oil with our kit?
With the kit, yes. And the reason why is because in the low potency form, for instance, we have like a 4x or anything 10x or below, you can easily combine essential oils with those type of homeopathics. When you get into the higher potency homeopathics,
what would be a high potency?
Well,
because I know a lot of people probably don't even know.
Right, so a 30C or 200C or even, getting up into the 1M, 10M potencies.
Which those aren't available really off the
The
shelves.
1M and 10M are not. You'd have to see a professional.
Okay, but you could go to Whole Foods and you
can get a 30C and sometimes a 200C.
Okay, and I've seen a 6X. So what you're saying is they could take a 6X and not cancel the remedy by having essential oil diffused. But
you make a very good point, because the strong odoriferous smell of the essential oils will cancel the action of the higher potency remedies. And so my opinion is, because the remedy is stronger, because it works on a deeper level, and because it is curative as opposed to just treating symptoms, I prefer to go with the remedy.
Okay, yeah, we didn't even talk about that, did we? The canceling of the remedy is a huge...
It is.
It's a huge reason why we in my house I always choose homeopathy first. It's just because I really don't know, whenever, now that I know the potency thing, that really helps, but I don't want to risk canceling the remedy.
Right, because the remedy will have a much greater effect than the essential oil.
Right. So is there handling instructions? Maybe if somebody does want to use oils in their home, they've gotten used to doing that, and they like to use that, they like the odor or whatever. Can we give them any instructions on maybe how to use both at the same time?
Small amounts of essential oil in, cosmetics, in soap, that's not a problem. What we're talking about is using medicinal strength essential oils, and that you don't want to do while you're using a high potency homeopathic remedy. Okay. And so you pick, and you do one or the other.
And we choose homeopathy.
I choose homeopathy
for all the
first.
reasons that we just described. But okay, say they're using a low potency. How would you go about, what's the best way? Do they I think that you've told me in the past that you would just want to make sure that you don't open the remedy with
our kit.
Okay.
You can use them together, no problem.
Doesn't matter.
Doesn't matter.
Or any low potency.
Any low potency is not not really a big deal. But when you get into the high potencies, it is a big deal. And yeah, you don't want to use them at the same time. You want to pick and go with one or the other.
Right, and storing them even in if you got a high potency.
You would not want to store a high potency with an essential oil simply because if the remedy wasn't closed tight, it could end up canceling the remedy.
And then you're just wasting your money.
Right,
and not getting
it's
any
not
effects.
effective.
It's not going to. More importantly, it won't work. So, okay, well, I think, was there anything else you wanted to talk about essential oils? I think that kind of clears the air.
I think that pretty much covers it. Now, in order to help make homeopathy more accessible, we should mention that we are putting out a kit of basic kind of home essential homeopathic remedies along with a class that will help people learn how to use them.
And we've already taught on the booklet.
Right.
There's going to be distinct instructions.
So we're trying at Marpe Wellness to make it easier for people to learn and implement homeopathy in their daily lives because it really can make a difference.
Yes, definitely. Okay, I hope that helps answer some questions. If you do have more questions for us, please feel free to just comment, on Facebook or on our blog, and I will try to answer as much as I can. And if anything that I can't answer, I will try to relay to Dr. Brown and get the scientific explanation for you. So thank you so much for coming and listening, and I hope to see you next time.